and welcome back to another episode of Nursing Surgery Day 11 with your nurse Haiqal from Group 26. Today I will be demonstrating to you on how to do CPR, or more commonly known as cardiopulmonary resuscitation. Before I begin the demonstration, we need to know what CPR means. Basically, CPR, or the longer name cardiopulmonary resuscitation, it is an emergency procedure of a first aid procedure that consists of chest compressions as well as some artificial ventilation that we will give manually to preserve the brain function of the patient until further actions are taken to restore the blood circulation. Simply said, if a patient asks us, or even some children may ask us, to simply explain what CPR is and the function, it is because when the patient, for example, stops respiring, the oxygen isn't getting to the brain. Now, oxygen travels in our body through our blood. And when the heart stops, in the cases of patients who need CPR, the blood is not moving anymore in our body, thus cutting off the oxygen needed from our brains to function and continue living. Thus, the function of CPR, where we do the chest compressions, is to allow the movement of the blood in the blood circulatory system. Simply saying, we are taking over the role of the heart by artificially chest compressing it. Now, let's go see how it's done. Now, this is our patient today, Mr. Teddy Bear. We begin with checking the consciousness of our patient, whether they can hear us or react to stimuli. Sir, can you hear me, sir? Notice how I am gently patting the shoulders. Sir, can you hear me? Usually, the patient will be unconscious. The next step is to hear for any breathing, as well as feeling at the opening of the mouth if there is any airflow. And if that is not present, then the patient has stopped respiring. Another tip is to check the tongue of the patient, because usually when the patient is in this position, the tongue would roll back and block the airway, causing asphyxia. However, in this case, the patient's tongue is not stuck. But now the patient is not breathing, and we check for the pulse. If there is no presence of pulse on the wrist, we begin the chest compressions. Now, use your dominant hand as the base and your non-dominant hand as the top. Now, the area that you will do the chest compressions will be in between the nipples, right down the sternum. So you will begin with 30 chest compressions and then 2 ventilations. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, we will give the ventilation to the patient. Make sure that you close the nose as such, and also tilt the chin. It is also known as a head tilt chin lift maneuver. At this time, you will want to see the chest of the patient to rise to ensure that you have given proper ventilation to the patient. Do that twice and continue with the chest compressions until either the patient becomes conscious again or until actual further help is given to restore the patient's blood circulation. And that is all, ladies and gentlemen. Goodbye.